so I just have to try to find from you, who you feel is at fault, and why, and then
I feel maternal fetal medicine's at fault.
Okay.
I feel Dr. Philip A. Schlossman is the most responsible because I asked him for more testing when I met him.
I'm sorry, what was his name?
Philip A. Schlossman.
Schlossman, wow.
S-H-L-O-S-S-M-A-N.
S-H-O-L-S-H-O-M?
S-S-M-A-N.
Sorry.
I mean, he's one of the 4 doctors at maternal fetal medicine. I mean, it shouldn't be too hard to find his name.
Okay, and let me just make sure I got it spelled correctly. I have it spelled. S-H-O-L?
Yeah.
I'm spelling it wrong, I'm sorry. S-H-O-L, did you say?
Yes.
S-H-O-L.
S-S-M-A-N.
Is he with Christiana Care, or?
He's worked with maternal fetal medicine.
He's coming up, but he's definitely, is that what you're referring to Christiana Care? He's with the hospital?
Is maternal fetal medicine the building there part of Christiana Care or no?
I'm not really sure. I know of the women's, I know women's help. Do you want me to double check with someone? Because, are you there?
Yeah, I'm here. Why don't you get a hold of Schlossman? He's at maternal fetal medicine, and call us back.
Okay, well, if this is the concern is with him, then the representatives would get in contact with with their department and try to get to the bottom of it. But do you want me to have a second, please?
Yes.
Okay. You're told something different than what was really happening?
A lot of things are concerned. baby has brain damage. That's the concern. And we expect justice.
Okay. And you feel like they're responsible?
Yes. Absolutely.
Because I know you did say,
We asked for more testing.
you asked for more testing and they didn't give it to you?
They didn't give it to us. He said there was no need.
Okay.
He said the anemia would be detected.
And he said there's no need.
Yes.
Anemia would be tested. I guess we'll just leave it like that. That there was no need. But he said anemia. I guess I'm not a medical person. As far as I don't know what that term means. Anemia.
Anemia is a breakdown of red blood cells due to RH factor. Well, I mean, it's not exactly that, but in her case, she was at risk for anemia due to RH factor from the D antibody crossing the placenta and breaking down the red blood cells.
So she was at risk for RH factor to begin with, or?
Yes, I was being monitored for it.
Okay, your wife was being monitored for it?
Yes.
Yeah, we did everything we were told. We did more than we were told. We asked for more testing. We come in on emergency around the time the neurologists tell us the brain stopped developing. And we came in and got a non-stress test at Christiana Hospital, and it came back fine.
A non-stress test?
Correct.
So everybody thought it was okay because of this non-stress test came back fine?
Yeah, and supposedly the MCA Dopplers were always perfect, or within limits.
MCA Dopplers?
Yeah, we're within limits.
I guess that means always correct, or pretty much...
Always within limits means once you hit 1.5 MOM, then you do an interuterine transfusion. He claims that she was always within limits, meaning our daughter did not need an interuterine transfusion. She was born with hydrops fetalis.
Oh, shit. She didn't need a intrauterine right?
Yeah, if she would have got an interuterine transfusion, then our baby wouldn't have brain damage.
Oh, okay, so possibly she would have got this then. You're saying that it would have avoided this, you feel? Is that what you're saying?
According to everything I've learned, and I've researched for 3 months now.
Okay. 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 Is there anything else you wanted to add?
I do. I don't like how they say that the machine simply missed it for a month. That ain't good enough for me. I went every week. That's not a good enough answer for me, and the whole thing is I want an answer of how this happened.
I'm sorry, you said the machine.
Yes.
The machine.
They said that the machine simply missed it for a month.
Simply missed
The anemia.
The anemia for a month.
anemia for a month.
That's not good enough for me.
Okay.
I was on different machines and had different technicians, and it's just real funny. On 36 weeks, it picks it up. Never did before. So.
Well, your records are conflicting also.
Yes.
And, the fact is we have the records. They're printed on Christiana's paper with Christiana's ink, and we have the White House involved in HHS. So, I don't know how far it's going to go, but I'd rather just handle this and make a settlement and be done with this. And that way we can move on with our lives and start being better parents to our children, because this struggle kind of takes away from normal life with the family. Do you know what I mean?
Oh, I can tell. I'm sure it's very stressful.
I didn't get to hold my daughter until she was almost a month old.
Oh, because I guess she was in the NICU?
She was at CHOP with all these wires coming out of her neck. She had a breathing machine that was breathing 100% for her. I didn't get to hold her until she was almost a month old. I was told she was going to die. Let any mom hear that their daughter or their son is going to die.